weren't just chasing a rank, they stayed steady when it got hard. They breathed through the doubt. They rested, recharged, and rose. They kept their vitals intact. Today, they don't just rank, they embody the rhythm of resilience.
Good evening, everyone. Welcome to another interview by one of the person who has secured a stupendous and amazing rank, Dr. Devika Nair. She has secured an All India rank of 71 in this year's NEET PG. And one of the most amazing things is this was her first attempt. Her internship ended in December, and by the time it was August, she had gotten this amazing rank 71. And not just that, she got a really good rank in INICET also in May. She got a 500 rank. In fact, she has joined in AIMS Bhubaneswar, but mostly probably we'll talk about that towards the end of the interview, what she wants to do. That's a different story altogether, but yeah, we'll talk about that. So congratulations, Devika. How are you feeling?
I'm feeling good. I'm feeling shocked. I was very shocked yesterday, and then now I think I'm like settling in, like
You're
taking it
settling
in.
Great. So Devika, Devika was a 360 degree live student at DBMCI 1. And can you talk a little bit? When did you join DBMCI 1? When did you join DBMCI 1?
I joined DBMCI 1 in December when I was just finishing up internship, and I decided that I had to come up with a strategy for preparing. And everyone had told about how the videos on DBMCI helped, like the concepts were made really clear. So then I decided that I would take DBMCI. I took it in December, and then I left college after all the shifting home and all that. I properly started my prep in February, like the beginning of February.
So basically, your NEET PG prep essentially was a 6-month journey, starting from February till, let's put it this way, till August 3rd,
Yes.
when the exam was
Yes.
conducted. Now this brings me to a very interesting question, right? Like, a lot of people start preparation from 3rd year or 4th year. They join the face-to-face batches at that point of time, or a lot of people actually, after completing their internship, they join a proper face-to-face batch for 1 year. Maybe instead of giving NEET PG 2025, they probably give NEET PG 2026, something like that. How were you? Did you join anything in your MBBS, or you were just a regular student, a good student in MBBS? And were you specifically preparing?
I used to study well in MBBS. Like I wouldn't say I would study throughout the year, but then just before the exams, 1-2 months, like I would sit and focus. And I think even in final year, like I was in the top 5. Like most years I was definitely in the top 10. Final year I was second. So I did focus a lot on university exams, and I did have Marrow. I used Marrow for some prep in final year, and final year was when I used Marrow mainly, for some subjects.
Yeah. So were you specifically preparing in a headspace to prepare for NEET PG at that point of time when you were in 3rd and 4th year, or you were basically essentially preparing for your professional exams?
Not at all. That time I was just preparing to pass the exam. That was my only mindset at that point in time. I thought I could start prep after internship or during internship. That was my mindset.
So in a sense, that if I talk about the NEET PG preparation part, 3rd and 4th year was not NEET PG preparation. You were just regular and good in MBBS. I think you're being humble when you say you studied for 1 to 2 months. You were getting ranked 2 in your university exam. You definitely were intelligent. But sure. So basically, we get to know that you are not someone who was specifically preparing for NEET PG in your 3rd and 4th year.
Not at all.
You were basically focusing on your university and your college exam. So internship, did you study in internship for NEET PG?
Not at all. Like I was under the impression that internship was the last year where I could be with my friends in my own college. So I did not study an internship, no.
That's fine. That's perfectly fine, right? I mean, and it's very true, right? I mean, a lot of people don't know, but you don't make friends during residency. They're essentially your colleagues. Friends are made during MBBS, and it was a great choice if you enjoyed your internship. So post internship, basically, when December, when the internship ended, that's when you finally decided then that you have to prepare for this NEET PG, and then you decided in December to join DBMCI 1. So what was your strategy? When did you complete, when did you complete your first read? When did you do your first revision, second revision, like that? Can you talk a little bit about that?
Yeah, sure, sir. I started properly in February. So I started in the usual order people start: first year, second year, then third year.
Hmm.
And as I was doing it, I was doing the module based questions. I wasn't doing PYQs. Just after I finished a chapter, I would do the module based questions of that chapter. And like that, I finished like the modules plus this in, I think, April mid. So a little more than April mid, towards the end of April. So it took me around 2.5 to 3 months for that.
3 months
And
for
then
that.
yeah, and then I started my first revision. I couldn't finish it before INI. And like I that's when I gave my INI and I got a rank of 507. And then I thought I would just prepare whatever I can. Like I thought I'll just finish my second revision for NEET PG. But then the date got like delayed
Hmm.
more. So then I finished it and I got a chance to do one more read because I was doing it very fast. Like I was trying to go faster at that point. And at the same time, I started doing PYQs. Like I started doing PYQs. Like I was doing some before
Hmm.
INICET, but I started doing them more seriously only after like INI and before NEET. Like I think from June and July, that's when I was doing PYQs. And yeah, that's basically it. I think I did about total around like three revisions, 3 to 4 revisions. Like two
3 to 4
revisions,
revision.
one read. Yeah.
One proper reading, right?
Yeah.
So from February, March, April, let's put it that was your first read when you made your notes or read
Yeah.
your notes, and then you did another revision in June, another revision in July, essentially,
Yeah.
and then you essentially gave your exam in August. Great. And you initially did the module based Q bank, and then later you shifted towards June, July, towards you at that point of time you shifted towards your PYQs. Great. So can you talk about the sources a little bit? If you were you able to complete all the DBMCI live videos in 3 months, or you essentially mixed and matched, used your weak subjects from somewhere else, strong subjects from somewhere else, like did that?
I definitely mixed and matched. There were 4 subjects that I knew that I needed to focus more on. They were
Hmm.
anatomy, pharma, and medicine. So I saw DBMCI live videos for this, and I wrote notes also on my own. The other subjects I was using rapid revision. So I had the notes were already there as PDFs. So I would read with like I would see the video, I would go through the notes. Like that's how I did those other
Hmm.
subjects. So it was definitely a mix and match.
Mix and match, but that's a good strategy. You realize that you have some weak subjects. You have these 4 weak subjects, which are anatomy, pharma,
Yeah.
opthal, and medicine. For that, you use the DBMCI one platform, the live videos, made your own sets of notes. For the rest one, since you were really good in MBBS, you directly shifted towards rapid revision videos, and those rapid revision videos already had the PDF. Made your job of reading the notes and revising those notes easier. I think that's how it helped, and then you were obviously able to do 2 more revisions of that. uh, a little bit about how frequently did you do your GTs, and when did you first attempt your GT? What was the score in the first GT, and how a little bit of journey of your GTs, if you can talk about that.
Yeah, the first GT I think I attempted in the last week of January, and my score was I got 102 correct. And after that, I shifted to maybe like I think the next one I did a few days later. Actually, I finished one subject and then I thought, no, I'll give it another go. And even then, like because it was barely a 3-4 day difference, I got 108 correct. And then I'm like, that's not going to work. And then I did on a 15-day basis. Then my score improved to 119, then became 120. Then eventually I touched 140. And I think the Marrow NEET PG mock, the mock exam that was there, in that my score was 180. That was like the peak that I reached. That
Peak
was,
there.
I think, in June or July. June I did it.
June I did it. So you can, I think, for anyone who's watching this video can understand. See, it might seem that her preparation was 6 months, but the fact that the base of that preparation was already made in her MBBS. She was regular in her MBBS. She was a topper in her MBBS. Who wants to be humble right now? She got ranked 2 in a professional exam. She was great in her MBBS. Sure, did not study from a NEET PG bent of mind in her MBBS, but the fact that her basics in MBBS was strong ensured that 6 months of dedicated NEET PG preparation for Devika were enough to get a 71 rank in NEET PG. And you can see, and that I think that NEET PG bent of mind is important, because the first GT she gave, she also got 102 corrects. But as she kept on doing the subjects, she did the weak subjects from DBMCA 1, Rest she used the rapid revision and a regular GT practice, and that's all you need. If you're regular in your MBBS and you have done the subjects from a professional point of view also fairly well, then 6 months to 7 months are more than enough to crack the exam, and Devika is a perfect example of that, I think. And she got the best of both worlds. She enjoyed the internship also, and still was able to crack the exam in the first attempt. I think you are one of the few people who really benefited from postponement. Would you say that?
Definitely, for sure. If I think if I gave it 15 days within I would not be giving this interview in any way or form. That is only because that extra 1.5 months that I realized, like, okay, this has been given to me. I have to push myself, and I just tried covering whatever I could.
Whatever you could. Great. So that's the thing. Very simple, straightforward strategy. Be good in your MBBS, and then 6 months of dedicated preparation of a mix. She did a mix and match, did rapid revision videos and weak subjects from DBMCI, won the live classes. Regularly gave GTs towards the end, did all the PYQs from June and July, did all the PYQs, gave the exam, and there she has rank 71. One question, like, I really want to ask you one question, since you are an example. Like, do you think that a lot of people prepare for 3 years for NEET PG or 2 years for NEET PG? Do you think that much is required, or do you think NEET PG has become a lot more on concepts of MBBS rather than asking facts, which was once the scenario? How did you feel? What was your feel of this particular NEET PG exam was?
I mean, there were facts. I'm not going to say there were no facts, but I feel like once your concepts become clear, it's a lot easier to remember the facts. They don't seem like, okay, I have to memorize this, I have to memorize that. It starts to make a lot more sense after that, is what I would say. Obviously, the way that people study, it's different, and I can't comment on that. But for me, this is the strategy that worked. I feel like because I had like an okayish base, when I was studying the subjects, it didn't take me too long to understand concepts. Like, I would go through the video once, read the notes once, and I would get, okay, this is this, this is that. Like, I didn't need a lot of time trying to understand it much. So I think, yeah, this is my view on this.
No, that's a perfectly valid view. The fact that you had a good base in your MBBS ensured that 6 months post MBBS, post internship were enough for you. Again, emphasizing that, how good you are or how regular you are in MBBS, and the concepts that you make in MBBS. Like you said, the importance of concepts in MBBS is because it makes the remembering of facts during these 6 months easier. Because you were good in MBBS, that's why you were so easily able, not easily, obviously it took a lot of hard work, but yes, compared to maybe someone else, you were easily able to remember these facts and these NEET PG related points in the 6 months, and then obviously able to apply them and get the done. Any advice, any particular thing from your own journey, any particular advice to anyone who's watching this interview, that you did this differently, or you want to ensure that they don't do this mistake, or they ensure that they do this thing correctly?
I would say don't stray from what your end goal is, right? Because there'll be a lot of, like, even though 6 months is, like, for NEET PG prep considered like a short amount of time, I think every 1 month, sometimes even every 2 weeks, you'll get this doubt, okay, this is not happening, I'm not able to do this. Like, the mindset will just go, the focus will go. Especially, I was at home, so you're not surrounded by people studying. That motivation of seeing people study, I was on the online batch also, so that was there. I wasn't seeing people like studying, so I was just like, okay, I can relax a bit. I think that is not good. Like, you have to, in the end, remember what your goal is and what you're trying to get at and what you're working towards, right? And anytime you feel low, like, I feel talking to your friends, family, like, in the end, everyone, like, all my batchmates were in the same boat together, right? So talking to people always helps you. Talking to your parents always helps you. It helps you clear your mind. So I feel like that's one thing that I got from this journey. And also that I feel, even if you're studying for maybe, like, obviously you have to study for like 8-10 hours per day during prep minimum. But even if you're able to study only 6 hours for whatever reason, you should make sure that those 6 hours are the best that you've studied, like, ever. Like, everything you read in the 6 hours, if someone asks you the next day, you should be able to tell, like, the page number, the box where you read that. And anything they ask, you should know. I feel like that also played a big role. Like, the quality of your studying should be
Of your study,
as high as you can.
As important as the quantity of your study. Exactly. Absolutely.
Yeah, exactly.
I think I can summarize whatever you said is be focused. Like there are
Exactly.
a lot of distractions. You have to be disciplined. You have to be focused. If you become distracted, if you become indisciplined, not losing track of your final goal, you won't crack the exam. Even if you don't get the time to study that much, but if you're focused in that and disciplined in those 5-6 hours, that's better than being studying 12 hours distracted. I think that I can probably summarize it a little bit better than that, and I think that's a very good mantra that any NEET PG aspirant can follow. Be focused, especially in the current world. मतलब, like if I talk about 6-7 years ago or 10 years ago, तो तब तो नहीं था इतना Instagram and Twitter and all this, right? Sure, we had Facebook, we did have. It's not that we didn't have social media, but now it's people like I always call it, people get high on reels, right? They will keep on doom scrolling and everything. So if you avoid that, I think you're on the right track. If you don't distract yourself too much. Now I come to the final question. Two questions, final questions. Who was your favorite faculty? Who was your favorite faculty in DBMCI? Any one for faculty, if you want to take someone's name.
Okay. I think I should say this. Anatomy was a subject I absolutely detested all through MBBS. Like, I have never ever been able to like it for some reason. But when I saw Dr. Ashwini's videos, and then I was never good at anatomy. Like, that was downright one of my worst subjects. I saw his video once from top to bottom, and I don't think I've gotten that clarity for any other subject. Like, I've never had to revisit again. Like, if any question came, I may have forgotten something, but then the minute I see it, I'm like, oh, okay, it's that, and then I would remember. And I will eternally be grateful for that, because that subject was literally my
No doubt
weakest.
about that. There's
It
a
became
reason
my
Ashwini
strongest.
there's a reason Ashwini is considered the goat of anatomy. It does make anatomy that easy for anyone and everyone who studies from him. And
Like,
the second question.
also, like, when they give you like what subject you did the best, it was anatomy was my best, and I would not have predicted that. So yeah, that's it.
So the second question before we end the interview, now with the 71 rank, what branch will you take when you so you have joined OBGYN at AIIMS Bhubaneswar. Will you stick to AIIMS Bhubaneswar OBG, or do you plan, no, you'll change your branch, you'll select something else as far as NEET PG is concerned?
I'm actually, there are two branches playing around my mind. One is OBGYN, the other is general medicine. Like, it was like that even before INI, but then with my rank, I wasn't getting general medicine. So now that the choices are open, I'm like thinking about these two subjects. Yeah.
All right. So hope for the best, and congratulations again, Devika. You have been nothing but an inspiration for anyone and everyone who probably watches this interview. Congratulations again. I think we'll take leave. Thank you.
Thank you.
Thank you.
The journey doesn't end here. Keep your rhythm. Hold your balance. Breathe. Reset. Rise.